A very good afternoon, everybody, and welcome to the sixth webinar in the series of Patient Support Group webinar series of ISBMT. So today we are going to discuss a very important topic of nutrition in BMT. So as we all know that so before we go on to the topic, I would like to introduce briefly the patient support group members. So this group is mentored by Dr. Shashikant Apte, who is president of ISBMT. Sir is currently director of Department of Hematology at Sahyadri Hospitals, Pune. We are also joined by Dr. Tapan Saikia, sir. Sir is director of Department of Oncosciences at Jaslok Hospital and Research Center. He is also medical oncologist at Head and Neck Cancer Institute of India, Mumbai. Then Dr. Revati Raj ma'am needs no introduction. Ma'am is one of the pioneers of pediatric BMT in India, and ma'am is at Apollo Cancer Center, Chennai. So apart from me, can we move the slide, please? Yes, so apart from me, we also have other members of the patient support group from other specialities. We have Dr. Venkatesh Ekbote, who is director at of clinical hematology and bone marrow transplant unit at Kamla Nayan Bajaj Hospital, Aurangabad. Then we have Ms. Ria Daruwala, who is psycho-oncologist at NH Bangalore, and Ms. Suman Kubal, who is nursing officer at ACTREC Mumbai. So, as we all know that optimal nutrition plays a very important role in preventing the morbidity and mortality in bone marrow transplant patients. And I think as physicians, we all know that often the most common questions that we get asked about are pertaining to the diet of the patient, that what should or what can a patient have pre-transplant, during, and post-transplant. So to address those questions, we have experts from across India today with us. And I would like to introduce the speaker for the speaker session today, Ms. Nandita Dhanaki. She is assistant dietitian at ACTREC Mumbai. Over to you, Ms. Nandita. So we have a speaker session for 20 minutes, which will be followed by a question and answer session for 10 minutes. And then we will have panel discussion for half an hour. So over to you, Ms. Nandita.
Good afternoon to all. First, I'll start sharing my process. But thank you for the organization to giving me the opportunity to do this. I really like patient support group meeting. It's a very much learning experience for me. I get to learn a lot about what is needed for the patient and how can I improve my practice. So is it visible? The PPT is visible, I hope. I will start with it.
Yes, ma'am. Please go ahead.
Great, thanks. So, good afternoon to all. I'm Nandita. I'm from ACTREC Hospital, and I would run through the nutrition and BMT general things what we need to consider for the process as so general things what we need to do for the whole journey. So we will run through it. Sorry. So things we will cover are what should be the diet before transplant, what all things we need to consider before transplant, what the patient needs to eat during transplant, post after that, what are the things to be considered as a caregiver. Normally the caregiver is very and plays very crucial important part in the whole treatment, but in nutrition as well, and where all the diet queries are supposed to be asked. So pre-transplant, it's absolutely important. The things, your health is extremely important. First, your current health. So patient must have undergone definitely some aggressive treatment before they are planned for transplant. So it is important that the weight, the height, and BMI of the patient is near desirable. It is very much possible. Some are already maybe in a good health. If not, you need to build it up. There are nutritional deficiencies which patient has. So how do we do it? What do we do about it? First, build up through a proper dietitianal counseling. So your build up includes a lot of balanced diet. Your nutrition deficiency correction needs intervention through your doctor or through your treating doctor. So that is extremely important because the the window between your pre-transplant where a lot of workup is done and before your transplant starts, there's a big window where this can definitely be, and it's very much possible to meet the requirements and build your body up. So how will you do it? How is it possible to do it? First, any of the information, there are a lot of misconceptions and misinformation which are around us, which tells us about diet, eat this, eat that. Any of the food PSG meeting, I've always made this that multiple sources tell us multiple things. What do we believe? So, a healthy diet with all the food groups, especially the Indian food groups, are never to be eliminated. Maybe the amount, the quantity needs to be, individualized as per the need. So, all the food grains, all the pulses, all the vegetables, all the fruits, the protein sources, your good healthy fats should be there in your diet in required quantity, which we will discuss ahead. Junk food, which you see at the top of the triangle, I would love to remove that completely. Okay, so that is something we need to focus on. Then is exercise. This is something which every patient is somehow neglecting or is not able to do because of their health status, or there is not enough encouragement. So I would like to encourage, I would also do, and maybe the team members can also encourage about the regular exercise and activity, not the gym. Hitting the gym is never the answer. Maybe little exercise, a walk, someone who's comfortable with a little bit of brisk walking, someone who's comfortable with yoga or want to learn or already know. So those can help you build up your muscles, because there might be nutrient deficiencies as we discussed. There might be your protein and lean body mass deficiency. So your strength is very less. So that needs to build up as much as possible. Next would be, so as we see the picture, whenever we understand that patient needs to undergo treatment or has some problem, the first thing with diet comes is मैं क्या खिलाऊं जिससे वो अच्छा हो जाए या उसका अच्छा हो. So it is always one ingredient which is focused on. कि it's pomegranate, so daily pomegranate, maybe four pomegranates a day. Apple, still we practice that if someone is ill, we carry apple with ourselves to them. So this needs to change. So here, because every food has its own quality, which is needed in our daily diet in interchangeably. Today this, today that. It need not be same thing every day. Okay. So here I would like to highlight everything red you see may not be high in iron, because with this disease we think hemoglobin is less, so iron is the only thing which will cure it, correct it. So anything red is not necessarily rich in iron and will not necessarily increase the blood. Some of these ingredients, yes, we will see further helps, but it's not necessary to give in excess quantity. So what does actually not help, which is there around? So a lot of ragi included foods, lot of iron-rich foods are being promoted in the supermarkets. It's shown to us in bigger letters and highlighted in the TV ad, social media ad. So I would, really like you to go back to the components written, the ingredients written, and read. The ragi may be the last list. So it's quite common now to know that the ingredient list, the first one which comes is the maximum in amount, and the more it goes ahead, it is lesser in amount. So normally in these products, ragi is found much later, and if percentages mentioned, maybe 1 or 2%. So it actually very misleading. So they may not be the best sources. Okay. So best source, your iron deficiency or your hemoglobin deficiency basically can only not be only iron deficiency, it can be other nutrients as well. So we will see what are the nutrients which can help you maintaining a good hemoglobin and other health as well. So first is iron, the foremost most discussed. I would tackle that. So as we saw the earlier picture, none of them are rich in iron. So what actually is the red color of the amaranth, our lal sag, is actually iron content. Okay, your ragi, yes, the source which you use. If you want to use it in your daily food as the iron itself, it is the best. You want to get to know a lot of recipes, get back to a dietitian. She will get you better recipes maybe, or our homemade products which we use how to in ragi, maybe use that. So that is a better source. Egg, to assimilate or to utilize that iron or other nutrients, we need a lot of protein in the body. So it's not just one ingredient, as I highlighted. There are multiple things which is required. So egg for protein, your hemoglobin, your globin actually is protein. So with heme, your iron, you need protein as well. And other things like organ meat, seafood, leafy vegetable, pulses, nuts, and millets. These are really rich in iron, and we should use them as it is, as a traditional recipes, normal recipes, which will give you better iron. So, as I said, protein is required for better iron absorption, and much better absorption is taken by your vitamin C. Vitamin C, along with protein, along with your iron, will actually help your iron absorption better. So, those Indian sources would be Indian gooseberry. Amla is very much in the season now. So, maybe stock them. Okay. So, there is papaya, there's guava, there's lemon. There are a lot of exotic fruits also, which is good in vitamin C, that is kiwi, broccoli. Okay. So we can use these things as well for making the iron much more available to us. Next ingredient, next nutrient which can cause hemoglobin deficiency can also be B12. Okay, so B12 here, egg of the B12 is actually a source of B12. Your yellow especially, so it can be included very well in the diet. Your organ meat, your poultry, your milk, seaweed, your bananas, your milk, your seafood. Okay, many of these things a lot of people don't eat. A lot of vegetarians are not preferring non-veg or are not able to digest non-veg. So a lot of fortified foods, or even if you take any milk products, will help you in meeting the requirement. Next, can your hemoglobin less can also be because of the folate deficiency. So as I mentioned, certain foods which see red, not all are rich in iron, but they are rich in other things. For example, we see beet here, but I would like to request, do not feed beet every day. It's a part of your diet, so should be a part of diet interchangeably. So then your egg comes here. So these we can use definitely interchangeably, one day this, one day that, more in our diet and frequency. Leafy vegetables and orange. So as I mentioned, all the nutrients, especially the one mentioned before, requires good protein to give proper hemoglobin synthesis. Okay. So what are the good protein sources? Your paneer, your dahi, anda, soybean, milk, your besan or any of the pulses. It's a form of pulse only. Sattu, which is now a superfood. Yes, it's a superfood, but again, use it interchangeably. It is your protein supplements if you're prescribed by a proper dietitian intervention. These are also, so many of times after a long time of treatment, I get questions from the patients that हम मसूर दाल खा सकते हैं क्या, हम राजमा खा सकते हैं क्या. They're almost on the verge of finishing their treatment. So it's a myth that you're supposed to eat specific food. So all pulses, all dals are absolutely acceptable and good source of protein and many other nutrients. But sometimes what happens, the digestion, because of certain anti-nutrients they have, is a problem, gives gases, you feel stomach upset. So they can be, soaked, roasted, sprouted, and used in diet. So the digestion and nutrient availability is better. Okay, so sprouted moong will be better digested and better nutrient quality than your normal moong just soaked some hour before and put soda for cooking it faster. So take time, it's okay. So better nutrients are delivered to your body. So here we see these are the protein and multiple nutrient sources which we can use for our body to build up. So protein for hemoglobin, as I said, and protein also for the lean body mass buildup, which you might have lost because of the earlier treatment. Future treatment needs a lot of body stores, not only nutrients, the deficiency nutrients like A, vitamin D, it also needs good lean body mass, okay, which is lost. So that you need to meet by protein, good protein. You need good protein, lean mass. You need fat mass also, which we will come ahead. So good protein sources would be your nuts if you're vegetarian. So walnut, almonds, your cashew nuts. Sometimes affordability becomes a problem. So you have peanuts, you have sunflower seeds, there is watermelon seeds. Okay, there's still okay, there is charoli, charmagaj. All this is also very rich in nutrients and also very rich in protein. Okay, there are exotic ones here as well. Hazelnut, if someone likes it. Okay, and peanut has a myth that peanut is not good for health. In smaller quantities, it's absolutely required for the body. So here we see the superfood, which is now, since 2 years, I think so, it has been highlighted a lot that millets. So they are actually superfoods. So, and I have mentioned the English names here, but there are definitely Hindi names to it, like finger millet is ragi. So in that form, we can actually promote more of the millets, and we definitely have some traditional recipes which we can use them in our normal diet instead of the modified form, which is now highlighted more in social media. Sorry, there was some music uh, uh, video started around. There's a program around. They've just started the. Extremely sorry for that. All right. So next would be, as much as you can. You can change the kind of colors in your food. That applies to your fruits and vegetables both. All right. So the more the color in my diet, the more nutrients will be there. So these are antioxidants. These are nutrients which actually help in building up better health. So the more color, the more better in my plate, in form of fruits, in form of vegetables, not the artificial color, but as it is. So I was coming back to fat. Sorry, the picture is not great. So it is ghee, oil, and butter. So ghee, oil, and butter again has some myths like it is not good for health. The moment we think about good health, we want to stop ghee, we want to stop butter completely. Yes, the salted butter is not extremely good for us, but in smaller quantity gives a lot of nutrient, gives a lot of palatability. So in smaller portions, and if it is not fried or deep fried, these things will help us maintain our body fat stores. Body fat stores are also important for us to build up our health. Okay, especially there's a layer of fat in all our organs, which is necessary for organ protection, but need not be in excess so to cause other problems. So as I said, the oil and fat is absolutely required. So half a teaspoon or a 1 teaspoon of ghee with our diet will absolutely not cause any problem. But the deep fried versions definitely will. So it is better to avoid them as much as possible. I would request all of them to completely avoid it, especially when you are building up for the transplant. A healthy normal diet, home cooked diet is always better than what we are actually toward nowadays eating with all the order ins and social media platform where newer foods are being introduced and we can just order in food and eat it. So a healthy diet before the treatment, so you build yourself better, is always preferred. So that I am done with the pre-transplant where we are building up our body. And once we have built our body, now we have to really do the part. So during transplant, what all things are important is going to be highlighted. First is safe food handling. Okay. So when so our personal hygiene, caregivers' personal hygiene, the food which I'm very sure if you're in a transplant unit will be given to you in the ultra most safe form. So, and to maintain that later in your degree, which is required, is important. Second would be hydration. So, because of lesser inactivity or maybe multiple reasons, so hydration is tossed. When the treatment actually started, a lot of hydration is given with medicines as well. But orally, it does help us to keep hydrated. Diet will be modified as per the symptoms. Okay. And this is a very different, difficult topic to touch on, that is prophylactic nasogastric tube. So before only thinking that your diet will be reduced or suspecting ki khana kam khayenge. So NG tube, a nasogastric tube, which is put through nose, okay, can be put pehle se. All right. So do not get scared about it. We will see why it is important. It is much of a part of the treatment, so it is required. You may all not require it, but some of you might be. So that depends on the care team which takes care of it. So during transplant, The main problem when patient gets admitted is absolutely fine. The only issue might be they might not like the food which is given in a certain center. We get a lot of that problem. Like, I don't like food here at all, even the rice. So that's a different story. So, but then they are able to eat somehow. The capacity or ability to eat is not affected. Once the treatment start, that is the time you get nausea, diarrhea, mucositis, constipation, loss of appetite, loss of taste. This all of things might not happen together, mostly all not together. But these are some of the things we need to be prepared about. And the extreme one would be graft versus host disease, which is somewhere near your other symptoms as well. So for nausea, a lot of alternatives are used in food. Strong smelling foods are not to be given. Hot foods are not to be given, and depending on what patient is able to take, so that we counsel them, ask them, understand, and then it is gone ahead with. Diarrhea needs a lot of lesser residue diet, which includes less gluten free and less gluten and less lactose. So we go for gluten free and lactose free diet only because there is diarrhea. It is not a standard treatment for throughout the treatment that you need to be gluten or lactose free. Okay, this is at least what the practice we do. Then there is mucositis. Mucositis can be of different grades. So those different grades could be, where you are able to eat soft, moist, or a grade where they are not able to eat. So your food modifications, it can be blended rice food, soft food, it can be completely liquid food, or if required, there may be total parenteral nutrition, which I will touch upon ahead. There is constipation because maybe you don't like the vegetable, or maybe the fiber intake was already low. There is loss of movement around, so constipation can also be a problem, and certain drugs also cause it. Loss of appetite, loss of taste because of the treatment, the food you don't like. Loss of taste is also because of the treatment and medications, so that can be a problem. So we will see what all corrections we can do for them. So here I will touch upon. So all these problems we saw. So how can we be a superhero in this issue? So if the new NG tube, the nasogastric tube, is used or is accepted well by the patient and the caregiver, we can be superhero out here. How? Because with these problems, we will be able to still get our ultimate nutrition. So, how optimum nutrition in patients who are undergoing transplant is met? First preferred method is always oral nutrition. Okay, but if it is not available because of the symptoms we discussed and many other symptoms, I highlighted those because these are the most common associated with food. So because of that, food is reduced. So we may use the nasogastric tube, okay, for feeding. But sometimes the nasogastric tube is also may not be put, or your gut is not functioning, so that is also not available. So that time we use total parenteral nutrition. As you can see in the picture, it is given in the form of the TPN written, given in the form as your saline is given. Okay, so there or in this form. So sometimes the person is on oral diet, combination with nasogastric tube, only on nasogastric diet, only on parenteral nutrition, various combinations. And as per the patient recovers, the TPN is reduced or the nasogastric tube is reduced, and then oral is completely started. So the combination throughout is absolutely important for optimum nutrition throughout the journey of the admission. So when we are on oral diet, what do we? So now once weaning off is done, you're removed of either nutritional or parental nutrition support, or either from your oral tube, NG tube support. So when you're eating orally, this may be introduced first, and then gradually as you gain confidence, it will be more of the oral diet completely. So drinks, it is easy to sip water sometimes, and then the juices which is available. So that is first the base we start with. Then after that, thin liquids, maybe rice water, rice kanji, a little thicker one, maybe ragi porridge, the slide one. Little thicker, we can go to very thin rava kheer or something. Then the liquidized or pureed form where ekdam thin khichdi or fully blenderized khichdi. Mince moins mean you will, put your hands in and soften it like your boiled pieces of potato. Okay. And then slowly you go back to regular food. So these are the modifications done and which is required for acceptable diet at that time. Okay, so now I come to when it comes to your taste loss. Okay, so we have a lot of patients when it starts with diet come like नहीं spicy food नहीं खाएंगे. Now spicy definition is with chilies only, but no, spices are a huge variety, so we can go through a lot of things. So there's haldi, there is elaichi, there is kesar, there's multiple things which we can use. These are superfoods as well. Okay, again we have ginger. Okay, we have jeera. So soft and everything can be kept with you. Ajwain can be kept with you where you will, and some certain powders, chaat masala can be kept with you so that it can be given added to the diet when there is loss of appetite. Lemon helps a lot. So and also the caregivers have a lot of concern, and it is very important to they play a very important role. So what is the role of the caregivers who are listening to me? So first, understand the need of the patient. It is not always easy. It is always easy for me to come and tell you feed this, feed that, feed that. But ultimately, we and you and all of us wants to do the best for them. So understand the needs, okay, and talk to us about what their needs are. If certain things are possible, we'll definitely do. Certain things are not possible or not, good for the patient at that times, because we have children also. There are sometimes vague requirements, so that can be, maybe counseled to them and tackled with. So that can be negotiated. Talk to the care team. That's what I said. It's very important. Talk to the nurses. Talk to the doctor. Talk to the dietitian. What are the needs of your patient? Convey to them. Okay. Encourage the patient. Again, it's a very difficult part, but let's all do it. And also, self care of the caregiver is extremely important because you will be taking care of the patient. Okay, so that is what I would then go to post-transplant time. So great, yes, you have overcome it. Now you're out, okay, out of the facility probably. But post-transplant care is extremely important as during transplant care, with nutrition as well and other things. So if you're on immunosuppressants, okay, which normally are, there are a lot of nutritional issues which arise. So first of all, yeah, there are a lot of immunosuppressants cause nutrient deficiencies, certain nutrient deficiencies. So that needs to be met. It causes losses of appetite. There are other issues like increased blood pressure. You need lesser salt intake in diet. So there is multiple problems. So there's sometimes overeating, but eating which is which you are not good for your health. So that needs to be monitored at that time. So get back to the dietitian with these problems. Adjusting to daily life, especially daily activities and exercise. Inside, you must be, during admission, you must be, stable and static at a place. So, getting active is a big step there, but let us go through that and achieve that. Okay. Recovering a nutritional deficiency. So, before treatment, we did that, but the treatment itself will also cause deficiencies again. So, correcting that is important, and gradually going back to normal diet, which we call like you were on BMT diet, now you're supposed to be a normal diet. It's just hygiene modification. That is it. Otherwise, it's we eat all food, we try feeding all food. So in all the phases, like pre-BMT, during BMT, and post-BMT, it's not one size that fits all. You need a very much customized diet, which I believe you need to get to a nutritionist, a dietitian too, and the whole transplant team to get fit as per you, because we also plan according to talking to our whole team what is required to the patient and then advise. So healthy lifestyle, as I said, exercise, good diet, which has all the nutrients. It's not that now I'm well, I need to prevent any other issues. So I will eat this food only, which a superfood is claimed by someone. So that we will touch upon, like ahead. So here I will show, this is my food plate. Okay. So this is by ICMR, Indian Council of Medical Research, and NI, Nutrition Institute of National Nutrition Institute. So this is for general population, but we can learn the quantities from it. Okay. The quantity of vegetable in my plate, the quantity of cereals in my plate, which is normally seen, which is high. Okay. So we need to change a little, include legumes and pulses, include visible fat, roots and tubers, your potato and all need not be in excess quantity, and yes, fruits. Okay. So as I was getting to, so now I want to get better. You're done with transplant. I don't want any other issues ahead. Okay, any other diseases as well. So I will eat this, which will kill my cancer, cure my disease. So this is all a myth. This, as you see, these are all social media pages or easily searched on phone also. This access is to the children also. So it's a request to the caregivers and patients, do not believe all, any of it actually. Go to a proper practicing person who especially you are seeing, and ask these questions. If you have any doubt, ask them whether these are true or not, and then only go ahead. Okay. And this is a myth which I always clear with everyone. That is your dragon fruit and your kiwi. They are absolutely good fruits, though tasteless. They have their own set of nutrients, but they are not as superfood as it is advertised. So if you want to include in your diet, definitely, but give more value to Indianized fruits more and then to them. Okay. I cannot claim that they are not healthy at all, but they are not as superfood as that you need to spend so much and eat it every day. Okay. So as I said, social media platforms, fad, and your myths, better to clear it with proper professionals. All right. So connect with us, communicate to us what are the myths you came across, or maybe you're practicing. Fad diets, I would like to highlight, like your gluten-free diet is not required for everyone, as I mentioned before. Then your diet, which is like ketogenic diet, is not advised for everyone. So it is always better to talk to a health professional. So who are the health professional? First of all, for diet, it will be a dietitian who has some expertise in transplant nutrition, because the needs are little different. Okay, so in your center, maybe look for them. Okay, and also all the whole nursing department, your dietitians, your doctors, your consultants. It's a whole team. So even whoever is able to answer will answer to you, or will direct to you the one who is an expert to it. Okay, so communicate your issues, your concerns, your likes and dislikes also. So it's always better, if we can do it. Thank you.
Thank you so much, Miss
I hope
Nandita.
I
That
finished
was
on time.
yes, almost. So well done. It was a very nice, comprehensive review of the food items that the patient should have, with emphasis on lot of emphasis on healthy and balanced diet, and what issues they can face during BMT and what we can do to address them. So thank you, Nandita. So we will move on to the next session for the webinar today, and that is a panel discussion. I would like to introduce the moderator for the panel discussion today, and it's a pleasure to introduce Dr. Sri Priya Venkateshwaran. She is Head of Content from Cuddles Foundation, Mumbai. And I would like to say briefly about Cuddles. So, Cuddles Foundation, it's a non-profit organization which associates with various public hospitals across the country and helps to establish optimal nutrition in kids, especially from lower socioeconomic status. So, welcome, Shri Priya. And I would like to introduce the panelist, our expert panelist for today. We are glad to have Miss Lakshmi Reddy with us. She is GM Nursing at Yashoda Hospital, Hyderabad. Then we have Miss Rajeshwari with us. She is Senior Clinical Dietitian from Apollo Cancer Center, Chennai. We also have Dr. Poni Shivaprakasham with us. Ma'am is Senior Consultant, Department of Pediatric Hemato-Oncology and BMT at Gleneagles Hospital, Chennai. And everybody knows Miss Nandita now. So over to you, Shripriya. And I would request the panelists that please try to be brief and crisp in your answers so that we finish on time.
Thank you so much, Dr. Shilpi, and it's a really nice pleasure to meet all of you today on a Saturday afternoon. And thank you so much, Nandita, for the comprehensive review. So based on that, the first question is for Dr. Ponni. So as we saw, we've understood that the nutritional status, is sometimes in certain children it's impacted. So what do you think, what does the impact of the nutritional status on the outcome of BMT?
Yeah, thank you for the question. Basically, about 50% of the children who undergo stem cell transplant or bone marrow transplant can become malnourished during the process of transplant. So as Ms. Nandita explained earlier, it's very important that early intervention plays a major role in improving nutritional status. Some of the reasons why they can develop malnourishment during the process is various factors, basically. Some of them are the underlying diagnosis and the treatment that they've had upfront. And whilst during the transplant, conditioning regimens, which can cause them more nausea, vomiting, which may also include TBI as a part of the treatment. They can develop mucositis, anorexia, or diarrhea, which can also lead to malnourishment. And with all of this in mind, they can have reduced oral intake. And with an increased basal metabolic rate, which they can develop during the transplant process, they're going to be in a negative balance, which may lead them into a very poor nutritional status if upfront their nutritional status is not good enough. Mainly what we worry about is the impact in transplant with regards to the nutritional status. When they come in with a poor nutritional status, and if it's not monitored well, and they continue to have more malnourishment during transplant, they can lead to reduced tolerability of the treatment that we offer during the transplant, which means the children or the patients can develop more side effects or more toxicity with the treatment that we offer. They can also have increased incidence of infection, increased incidence of graft versus host disease, and this can lead into another cycle of malnourishment. This would eventually lead to delayed recovery and sometimes can be very detrimental to their health. So what is very essential is constant monitoring and early recognition of the nutritional status, and the decline of nutritional status is very important. And to prevent all of this, we can have an early intervention prior to the patients coming into transplant.
Thank you, Dr. Ponni, for that. So as we saw that the correcting of a nutritional status of the child so that the child is not undernourished or overnourished is extremely important. So that brings us to the next question to Ms. Rajeshwari. So when you're preparing a child for BMT, how long does it take for you to correct the nutritional status of the child before BMT starts?
Very good evening, and I want to thank Indian Society of Bone Marrow Transplant, and thank you, Sri Priya, for taking up the question. It is really what Puni ma'am and Nandita was talking about. It is essential for every individual who is being planned for bone marrow transplant. Either it can be an adult or it can be a pediatric population. We have to do the nutritional assessment, screen the patient for the malnutrition. Either it can be well nourished or moderately malnourished or severely malnourished. Probably prior to the bone marrow transplant procedure, we need to emphasize on the nutritional state. We have to improvise the nutritional status so that we can bring down the mortality rate and the complications like such as the infections of gut versus host disease, GVHD, and all, we can reduce it up. So the time taken for a patient for preparing for a BMT, if a patient is malnourished, probably it will take 3 to 4 weeks for preparing themselves to become nutritionally fit for the bone marrow transplant. So because generally we won't be knowing most of the patient's previous history, the diet, neither the clinical history also, most of us we won't be knowing it. So it is possible when we come to know that the patient or the kid is having been malnourished, probably we can start intervening the patient as much as faster, either with the oral diet, with oral nutrition supplement, we can start it up. We can improvise the nutrition status before entering into the BMT procedure, we can do it up. So I think minimum requirement, it takes us 3 to 4 weeks it's required for taking correct the nutritional status of the individual.
Thank you so much, Rajeshwari. So as you mentioned that it takes us a lot of effort to make sure that the child is, up to date on, nutritionally when we start BMT. And as we've spoken and, we all know that the side effects that happens as a result of BMT can now again impact the nutritional status. So that brings us to the next question, and this is to Nandita. So what are the key nutritional measures that you would take or consider to ensure that the side effects of BMT are reduced?
First of all, so the highlighting which I did and other speakers did as well, that build up before the treatment is a window where it is extremely important. A weak body has there are data I think it's available. A weaker person has more side effects, more issues, and more infections. So it is better to be in better health when you are going for a transplant for an extreme treatment. Next would be the expected the side effects. Basically, if it is going to be constipation, so eat a higher fiber diet, okay. And if it's going to be protein deficiency, eat higher protein. If there's going to be mucositis, maybe better oral health, okay. So these are the few points which they can highlight on.
Okay. Thank you so much, Nandita. So, you mentioned about how we can take sure preemptive steps that can be taken to ensure that the children don't suffer from as many side effects, right? However, there are certain side effects which are like some things like mucositis that sometimes whatever you do does occur because of the nature of the treatment. So that brings us to the next question to Ms. Lakshmi. So, as a nurse, right, how would you ensure that optimum nutrition is met when a patient has severe mucositis? And as we all know, as mucositis progresses, the food intake is actually reduced. So, so how would you ensure this? And as a nurse, what are the steps you take?
Yeah, Sripriya, you have rightly asked. So, as a nurse, what we do, it requires a comprehensive approach. So, first we will start with the assessment and collaboration. When it start with the assessment, we assess the patient nutritional status, as Nandita mentioned. So, we will evaluate the patient's nutritional needs, taking into account whether their medical history, current conditions, and treatment plan. So when it comes to the collaborative with interdisciplinary team, that in the hospital in Yashoda, we have developed integrated nutritional plan. So that works with the patient's physicians, dietitians, and nutritionists. And even if it is required, we will involve even other healthcare workers, which we will sit and we will discuss and collaboratively will develop as a personalized nutritional plan. After assessment and plan is developed, then we will see the mucositis management. So when we talk about mucositis management, first we will target pain management. How we will ensure? We will ensure adequate pain management to reduce patient discomfort. As per the doctor's advice, we'll go with the syrup xylocaine viscous, which we give half an hour prior for the food, which will smoothen and it will promote oral intake. And as we all know that we will give the mouth care. How we will give mouth care in our organization? Earlier, most of the people were using chloroxidine mouthwash. So nowadays, completely it stopped, and we encourage saltwater gargling, or we will go with the 0.9% sodium hypochlorite solution. So what we do, we go every 4th hourly, or as per the requirements, it can go for even 6th hourly. So after, why we have to encourage this mouth care? Regular mouth care is very, very important to prevent infection, promote healing, and reduce discomfort. So along with this, what we do, we give the topical agents. Like when it comes to the topical agents, such as anesthetic agent like a Zytic gel, that is just a topical agent which we will apply. As per the doctor's advice, we can apply TID or UID. That means 4 times per day or 3 times per day. What we do before 2 hours prior for the food or after 2 hours for the food, because it increases the nausea and vomiting. But to avoid that, we will apply topical solution prior to 2 hours prior or after 2 hours. And after this, what we will see the nutritional interventions, as Nandita mentioned. We'll provide nutritional supplements as per the dietary requirement, dietitian's recommendations, such as nutritional drinks to help meet the patient's nutritional needs, where patients cannot able to eat soft food. Still, they cannot even take the oral. We go with the TPN. That means total parental nutrition. It considered to provide essential nutrients, including proteins, carbohydrates, fats, vitamins, and mineral. As I mentioned, when the patient is unable to eat.
Okay. Thank you
And
so much.
along with this, we do monitor the patient. The tracking is very, very important about the nutritional status, including weight, albumin levels, and other relevant markers as well. So along with that, we will adjust the nutritional status. And when we monitor it, we will strictly monitor the IO chart and daily weight. Whenever patient has GVHD like a loose motions, so we will even check the diaper weight. It will improve to adjust the nutritional status of the patients. Along with that, we have to involve patient and patient party, that means family, to encourage to part of this process and easy to understand and easy to overcome out of these issues.
Okay.
So by following this comprehensive approach, we can help ensure optimal nutrition for patients with severe mucositis during BMT, promoting their overall health and well-being.
Thank you so much, Ms. Lakshmi. I think it's a multi-pronged approach is what you actually mentioned, where it involves all the stakeholders and multinodal way of addressing this. Thank you so much. So when Nandita was actually giving her talk, she was talking about nutrition deficiency, addressing nutrition deficiency even before we start BMT. So this brings up me to the next question, and this is addressed to Dr. Ponni. So there are sometimes it's very difficult to perhaps address all the nutritional deficiencies through food. And especially since the child might be eating in a very limited quantities. So are there any supplements that you provide before or during BMT to address nutritional deficiencies? Some things like vitamin D or things like that. Every hospital has a different practice, so we would love to hear from you what you do.
Thank you. Thank you for the question again. So as Ms. Nandita had explained earlier in her talk, lots of nutritional deficiencies which may occur prior to transplant because of the previous treatments, etc., can be rectified before they come up for transplant. So for example, certain vitamin deficiencies like B12, B6, vitamin D, these can be rectified prior to coming into transplant. But during the transplant process, there are very minimal nutritional supplements that I do use as regular. One of them is vitamin D. Not just because it can aid faster recovery, reduce the chance of infection and GVHD during transplant. It's also important for a late effect or a long-term issues post-transplant, because we do worry about bone health in these patients on a long term. So we should be mindful that we could be supplementing them with vitamin D during transplant. And there are a couple of other things that I do use. Glutamine, which is an essential amino acid, which could also be used. There are evidences that it can reduce mucositis, and people do use it quite regularly. It improves tissue healing, thereby reducing GVHD again, aids faster recovery, and the same thing with zinc supplements as well. But these are for patients who can take food or supplements orally or enterally. Sometimes we have challenging patients where enteral feeds cannot be possible. So we should be mindful when they're on TPN that there could be other micronutrients which could become deficient as well. And that's quite important to monitor them throughout that period when they're on TPN to replace micronutrients if they become deficient as well. This is all keeping in mind that we should help patients recover faster. Thank you.
Thank you so much, Dr. Ponni. I think, as you mentioned, like every patient, I think you'll have to look at it in an individual, basis, and then kind of take a call on those in addressing those nutrition deficiency or side effects of that they undergo. So the next question is for Rajeshwari. We see there are a lot of like protein supplements, nutrition aids that are prescribed to children, while they are undergoing BMT or even before. So what are the role of semi-elemental food powders? And we were talking. I mean, Nandita was talking a lot about home foods, the role of having complete home foods. So what do you think are the role? Are the semi-elemental protein better than natural foods, and or what is the place of these kinds of powders in a child undergoing BMT?
Yeah, actually, there are plenty of SMLP formulas that is available in the market, and moreover, why that is essential during bone marrow transplant is probably they'll be having a gut is compromised, they'll be immunosuppressed. So in that case, already the food intake will be very minimal. They won't be able to meet the daily requirements. And even if a small portion, if they're having it up, probably these supplements will help to replace or will help to balance the nutrition deficiency in those individuals. So that is the reason we can use the semi-elemental, which is rich in MCT. We can have it though the gut has been compromised. Probably this will be a back-end support that help the person to overcome the nutritional deficiency. The initial phase of post-bone marrow transplant, we can start using it up. I'm not saying that we have to totally replace the natural food item with the semi-elemental formulas. We can go ahead with having half of the thing with the with the natural food items, and we can have replacement at least 1 or 2 servings of the semi-elemental MCT enriched formula feeds. We give some amount of calories. If a baby or if an adult patient is having hardly a bowl of rice or something like that, or a dal rice or something like that, probably that will not be sufficient for the daily requirement. So in that cases, probably these supplement will be giving a back-end support that will be giving you some energy during the initial phase. So probably this will help them to use it up initial phase. Probably once the intake has been, is been reverted back to the normal, the quantity wise, when we monitor there, the quantity wise gradually it has been increasing. Probably I think this can be withdrawn gradually. We can withdraw those commercial feeds with the simple elementary formulas. We can withdraw.
Thanks, Rajeshri. So basically, you're saying semi-elemental food feeds basically helps the child absorb the nutrients in a better way because it's in a broken down form. And especially when they're going through side effects of like diarrhea or something, it's easier for them to absorb and you're providing it to them in a concentrated manner. We move to the next question, and it's addressing another side effect of mucositis. So Nandita was actually mentioning about how she tapers, from parenteral nutrition to like normal, feeds. So this question is, when mucositis settle, how do you do this when with mucositis? So as mucositis settles, what is a step-by-step plan, when you start reintroducing feeds or proper food to the child?
So, mucositis is, as sister said, that it's by, it's not always preventable, it is part of the treatment. It might happen even if it is
Nandita, I'm so sorry, but you're breaking up.
reducing. Okay, so your now.
Yeah, it's better, a little better now.
Okay, so the moment the mucositis, the severity comes on reducing, we need to start, introducing them to foods. So as I discussed, first of all, probably the parenteral nutrition is started if the severity of the mucositis is very high. So we need to start tapering it off and introduce more food. Here comes to play are two things. One, your different consistency of diet, which we addressed in the presentation, and second is what Rajeshwari ma'am was saying also really helps here, because here the food may not be acceptable much even if we modify as much as can. So in that situation, maybe use of a supplement at that time to meet the nutritional needs, and as in gradually the patient's intake, different patient responds to different. So initially liquid diet, then a semi-solid diet, then a soft diet, which is bland at room temperature or cold, in smaller quantities as per their palate, and gradually maybe go to soft food and solid foods. And truly it depends on the patients. Some, if it's a child, they actually recover. Sometimes if they feel like even with issues, they want to eat, so they eat. And certain it takes time, so it's patient based how they are recovering, how they are accepting it, and tapering the diet as their acceptability and reducing the tipping accordingly.
Thanks, Nandita. So, as we all know, we have all spoken about preemptive or, prophylactic enteral nutrition or the NG tubes. But this is something that's always, something that patients are always wary of. And, there is a lot of resistance from there. So, the next question is to Ms. Lakshmi. Like, what is your experience with, when placing an NG tube for feeding a child? I mean, we all know that the trophic feeds with NGO has great benefits. So please, can you please share your experience, Ms. Lakshmi, on how patients can benefit with a temporary NG tube? Can we please change the slide? Yeah,
when it
please
comes
go
to the
ahead.
nasogastric tubes are often met with resistance. So 99% patients will not accept. So we do come across and we have a lot of resistance, but they can be a lifesaver for patients who require temporary nutritional support. Before going for the benefits, I would like to talk about explaining and benefits and then how we have to explain the procedure. So we should give clear explain the benefits of NG2 placement and how it will support their recovery. That is the first step. When it comes to the next, we should have a lot of listening skills to the patients or family about their concerns, and we need to address step by step when they have a fear in a compassionate and empathetic manner. We cannot be hurry up. We have to spend a lot of time with the patient and family. That is the second step where we have to minimize the fear and anxiety about the NG tube. And when it comes to the NG tube, they will get scared what kind of tube they're going to insert. So what we used to do, we get the mannequin and we will demonstrate them. So this is the way we are going to we are inserting the process of the help them to understand what to expect. So after that, what we do, we will emphasize the temporary nature. We will tell that this is not the permanent. This is only temporary. So that means we will give the reassurance to the patients when we are inserting NG tube is a temporary solution and will be removed as much as earlier or if it is possible. So that is the way we will empower them. And again, we will ongoing support. That means whenever there is a requirement of additional support or education, it will be adjustable and it will be removable wherever is needed and whenever is required. So this is a way we will give the health education and we will support them and morally, and we will empower them to take the NG tube. After that, we will explain about the benefits. So NG tube enables patients to receive essential nutrients, vitamins and minerals when they are unable to eat orally. Especially, we have a challenges with particularly about who are all undergoing chemotherapy, radiations, and surgery cases. So we will be more focused and we are keep educating and encouraging them to take the NG tube. After that, we will see how it helps to maintain their weight. So we will reduce the risk of malnutrition with the NG tube feeds, and it may be reduce the collaborative and complications whenever there is a requirement. When we insert the tube, and we will check the daily weight whether it's increasing weight or not as well. Along with that, this will help to the wound healing. So as we all know that whenever as Nandita also mentioned, there are a lot of malnutrition when there is no adequate feeds. So for that, we will say that it will be helpful for this will work as a vital for wound healing. The NG tube ensures patients receive the necessary nutrients to supplement the healing process as well.
Okay.
And will focus on the reduce of risk of malnutrition. So it will, which that means it will help and which can lead to range of complications, including weakened immune system, poor wound healing, and increased risk of infections.
Thank you so much, Ms. Lakshmi. So as you said, in placing an NG tube, preemptively can actually help break the vicious cycle of malnutrition and, address side effects. So we all spoke about, nutrients. We spoke about vitamins, minerals. So just switching the topic a little bit, the next question to Dr. Ponni on electrolytes. So we all know that the medications that are used during BMT can cause a lot of imbalance in electrolytes. Can you quickly tell us what can be done to replace these salts? Dr. Ponni?
Hi. Yes.
Hi.
So so as you said rightly, salt imbalances or electrolyte imbalances can happen in patients because of varied side effects, medication, some immunosuppressants, conditioning, or VHT, gut loss, or infections as well. So the way we replace them are two ways. Just to keep it simple, orally or intravenous. based on how the patients can manage. One way to monitor them is to regularly do bloods, making sure the potassium, calcium, and magnesium are all measured on a frequent basis, because these patients can lose these electrolytes very easily because of renal losses. So patients who can tolerate very well orally, these electrolytes can be replaced orally or through NG tube, a temporary NG tube that may be placed. Sometimes this can itself cause more nausea, like potassium replacement with pot clo can also cause more nausea and vomiting. So we have to be extremely careful of what patients can tolerate. Or the other option will be intravenous administration. It's not uncommon. Sometimes we've had patients who come as an outpatient still needing some electrolyte replacement orally as well. So don't be worried about replacement of salt.
Okay. Thank you so much, Dr. Ponni. The next question is for Rajeshwari. So we all know during BMT, there are a lot of do's and don'ts that the child goes through, and depending on the side effects and also the kind of foods that they can eat. So if a patient has a special request for certain foods during BMT, how do you work with the medical team, and how do you help the child ensure that the child gets what he or she wants?
So that's the only thing is the biggest challenge is you want to make a patient eat. So that is the biggest problem. It can be the adult or the pediatric populations we have it. So probably if there is a special request from the patient end, we try to fill the request as much as possible and make sure that is whatever the criteria, what the do's and don'ts should be followed. Also, we'll take into consideration. The major thing which we want to avoid is anything raw to be avoided or anything spicy we can avoid it. Make it less spices and less oily. We can try making it up. So with the help of the physicians, we can try. We're trying and we are fulfilling the request also. And moreover, sometimes we'll be trying some smoothies, because being a pediatric or even the adult population likes smoothies. We try making this, the elementary formulas. We try making it as a smoothies. We can try it out. So some difference we can make in their usual diet, so that makes them to feel palatable to have the food also. So, and even being a pediatric, they want to try some variety rice, or they want to try some fried rice or something like that. In that case, we make sure they have the food is well cooked and without spices. We make it specially for them, and we'll try to fulfill the needs also. We'll try to make it up. So surely we'll work on that, and we'll make the patient happy also.
Okay, so I think this is where the chef's hat, Rajeshwari, and make sure that the child gets what the
24/7. So yeah, true. I have to thank my FMB team too in that way, because this is what the request is needed. Immediately they make it up and they'll serve to them. So probably it'll take, if in case anything apart from the menu, if they want to get it, probably it'll take some time, but things will it'll reach the patient as much as possible. It reach the patient.
So this is where you really get creative in your diet plans. That's
Sure.
amazing. That's amazing. So, but Rajesh is talking about foods that they eat, but then there are certain situations where the child is nil by mouth. So the next question is to Nandita. So if a child is nil by mouth for any reason, how do you support the nutrition for this child?
Okay, so there are many situations in which patient is a child or adult or nil by mouth. So there we support nutrition by total parenteral nutrition, or if the gut is accessible, if enteral tube is there, maybe it is the NG tube. So I would highlight NG tube feeds, multiple feeds can be given, nutritional supplement can be given, certain hygienic nutritional feeds which is from kitchen also be given. And if it is TPN, basically TPN, if the gut is not accessible and patient is nil by mouth, by that TPN provides us, as I touched upon a little bit in my presentation, so it gives us fat, protein, and carbohydrates in the form where the saline is given. Okay, so there your mouth or your gut is not accessible then. So, and it's temporary, like NG, it is much more lesser temporary than NG tube. Both of them, your NG tube or oral, can also be utilized to correct electrolytes, as Poni ma'am connected, or the TPN can be used to correct certain electrolytes as well. And then slowly, as in mucositis, I said, once your gut or your oral ability to eat is available is better, then slowly it is tapered off, and oral foods are started. So it's a temporary diet, but it's very essential to meet the nutrient level of that for that particular time. And also the same thing as oral diet, the same formula that no one size fits all. So there are different volume bags available. There are different combinations of TPN available. There are different nutritional supplement, as Rajeshwari ma'am mentioned. There are different supplements available, elemental and semi-elemental. So whichever fits the patient requirement and their acceptance and tolerability, it's planned as for that.
Thank you so much, Nandita. So basically, the NCP process of nutrition care process, where you constantly keep reassessing and evaluating, comes into the picture, and then you take those corrective measures on a day-to-day basis, right? So, when a nutritionist is there in the BMT, she gives the plan, she makes sure, and then she goes back. But the nursing staff is the one who is there with the child most times, like 24 hours, they're taking care of the child. So the next question is to Miss Lakshmi. So there is a lot of distress and anxiety related to food restrictions during BMT. So how do you support a child during this difficult time, given that you are next to the child for most of the time?
Yeah, I totally agree. It's a challenging for us. And what we supposed to do first, we have to strongly connected to the emotional. We should give the emotional support to the baby and as well as parent. And we have to validate patient's emotions, and we should acknowledge the frustration, anxiety, and distress caused by food restrictions. And we should be actively listening, as I mentioned earlier. So baby consent and as well as mother consent, and we should provide a supportive and a non-judgmental space. Like for example, we should not judge and for their expressions. We should allow them to express their feelings. Okay. And always we should give reassurance about empathy. That means their feelings, it's normal, and that you are the support. We are here to support, and there is no issues, and we are here to take care of our entire process. As like that, we should give the support for entire journey of the BMT process during whenever there is a issue with the food. And when you have to give the clear guidance, that means when we are explaining about the process, and we should give the clear, and it should be consequence explanations of the necessary food restrictions, and we should highlight the importance of infection prevention and management. As a nurse, we should be more focused on infection control preventions. Why means because these patients are immunocompromised patients. So when we highlight, and they'll also be serious and they will take the food, and in such a way that we have to encourage them, and we should give the guidance. That means personalized dietary guidelines, which we have to give, as Nandita mentioned. And we should not go with the social media. We have to go with the appropriate personals, and we should help them, and we should encourage them, and we should give the adequate and exact food. And
Thank you so much, Ms. Lakshmi. So as you said, you have to be supportive, you have to be empathetic, and you have to have an open communication with the children to make sure that they're going through this. Thank you so much. So this was the last question of the panel discussion. So if there are any more questions, you may ask, or then I give it over to Ria. So do we have any questions, Dr. Silpi?
I think we don't have any questions.
Okay.
Thanks, Shri Priya, for the excellent moderation, and to the panelists. So over to you,
Thank you so
Ria,
much.
for vote of thanks.
Thank you. Thank you, everybody, for joining us for today's session. I'd especially like to thank Nandita for giving us that very insightful talk, and Shri Priya for moderating a very interesting panel. Thank you to all the panelists who joined us today, and of course the ISBMT team who puts these sessions together on a regular basis. Thank you to all the participants, and we'll see you again next time.
thank you all.
Thank you so much. Yeah.
Thank you.
Thanks to the team.
Thank
Yeah.
you all.
Bye.
Thank you. Bye.
Thank you.